Endometriosis at its most simplified level is when the tissue that should be inside the uterus that you shed every month with your period, you get implants of that tissue outside the uterus. So that can be in your pelvis, near your bowel. It can cause pain. It can cause discomfort with bowel movements, discomfort with intercourse, and overall can affect fertility as well. The most common symptom that you have with endometriosis is painful periods. And I think what happens a lot is that women that have that think it's normal. And I guess the take-home message is that painful periods isn't normal. Along with that pain are a lot of inflammatory factors that can cause issues with fertility, and it can even cause significant pelvic scarring that can affect things like the ability of your tube to move fertilized eggs into the uterus. But it also just affects women's daily lives, and so for just women's health in general, I think it's a really important concept. I would encourage them to see their doctor and talk about that and be open to talk, because a lot of women don't want to talk about things that they're experiencing with their period or with pain with intercourse. I mean, don't even go there. But it's things that you need to mention when you see your gynecologist. And as reproductive endocrinologists, we specialize in the treatment of endometriosis. There's a lot of things that we can do to help women treat it and or manage their disease. So when we're looking at those implants of endometriosis, we know that if we can remove the disease that we can see, that there's a definite impact on the fertility in the months that follow that surgery. So people that try to conceive after having laparoscopy for endometriosis have higher fertility rates than before they had surgery, not to mention lower pain score rates. Even if you're not attempting fertility, there's a number of treatment modalities that we can look like to help you deal with the periods that are causing pain. I mean, when you're talking about 1 in 10 women having endometriosis, regardless of whether her symptoms are mild or severe, I don't think 1 in 10 women out there are talking about it. It's not something that is a horrible sentence by any means, but it can be if women are suffering in silence.